Hi, it's your girl Charlie. Welcome to Charlie's Voyages. And so today we're going to talk about the reconstructive surgery. Now, this is a very sensitive topic to me because I'm still trying to get over the effects of it. So let's start. So in 2008, I did a consultation with a surgeon, a plastic surgeon, at the hospital where I had my mastectomy and my cancer treatment, which was UNMH Hospital. So the surgeon, he was such a nice guy. And actually, him and his wife, my mastectomy, the surgeon who was going to do my mastectomy, and they were married. So, but anyway, great people. However, he explained to me my options after looking at, because what they do is they look at your breasts, and at the time I had both my breasts, so they look at your breasts. He knows what's going to happen, the mastectomy, and they basically prep you for that. Even like the surgeon who's going to do the mastectomy, the question is, are you planning to do reconstructive surgery? And based on that is how they'll pretty much leave some nerves in your breasts or in your chest walls, so that the reconstructive process will go well. I went to see him, and he explained to me that my only option would be a tram flap. And a tram flap basically is when they take one or two of your abdominal muscles. So that six pack that you thought you was gonna get, you can't do it. So they take one or two of those muscles and they rebuild your chest walls with it, and then they find fat on your body, either from your back or your abdominal area, where they can use as a breast, as the cushion part of your breast. What I didn't know was it was an organ transplant, and you harvest your own organs. They didn't explain that to me. However, this was my first consult. I guess at this point it probably wasn't necessary. And so one of the questions he asked me was, are you planning to lose any weight? And so I said, well, yes. And he said, well, the reason why I'm saying this is because based on, if you lose weight after the surgery, then you'll lose some of your, the breast will change in size, in the shape and size. So it's best to, if you're going to lose weight, do it before the surgery. So I said, okay, and he was, so I thought that was okay. So for the next 4 years, I kept trying to lose this weight. So that was 2008. And then I had my next consultant, probably December of 2012. And in between that time, I literally was trying to lose weight. But when you try to do something, sometimes it doesn't work out quite the way you like. And in between, what I didn't realize was in between each layer of fat, of fatty tissue, is an issue. It was the reason why I got fat in the first place. So what I did was I went for a consultation with a different surgeon, because the surgeon at UNMH was no longer at that hospital, where he was getting ready to transition out. So he wasn't seeing anyone. So it was recommended to me by two of my doctors, this particular surgeon, and I won't mention his name, but because I don't know if legally I can mention his name. However, I was told he was one of the best surgeons in Albuquerque, so of course I went to him and I did a consultation. He was intimidating, and at the time, but he was very, like, as a matter of fact, I can get this done for you, and so he was my second opinion, because the question I asked him was, do I still need to lose weight in order to have the surgery? Now, the reason why I'm in need of the surgery at this point was my body was starting to twist a bit, because I had this very large breast and then I didn't have any breast. So you could imagine how that was a bit painful. And just, when you talk about body imaging and you talk about emotions and you talk about trauma, you factor all of that in. Okay. So anyway, he was like, yeah, as a matter of fact, I can get it done. He did not say anything about the weight loss. He just said he could get it done. And so I was like, well, okay, because I figured that if I did need to lose weight, maybe, he had a program that I could go through, like they do people that do the gastric bypass, that, where I can have assistance, because I couldn't do it by myself. And so when he said he can get it done, I trusted him. See, I was silly enough to still believe that old school mentality that my doctors really had my best interest at heart. I kind of forgot because, I spent so much time trying to heal from the cancer and so many side effects from that nowadays it's just about that money. So, and I'm not saying all doctors, because I know some fabulous doctors out here who actually really do give you the whole perspective. They look at you as a whole person and not just a project. So, and not just a means to an end. So anyway, he wanted to schedule me like real quick. And I was like, wait, no, hold on. I don't want to move that fast. To myself, but I just put them off. I said, no, that's too soon. You want to do it in January, that's too soon. So then they planned it for April of 2013. And because I it's much more to this story, I'm going to end it right there. And, next week we will get into the process and the prep of the surgery and what happened that traumatized me severely. And, this is probably going to have to be done in like 3 parts. So this will be the first part. But I thank you so much for listening. And at this point, I'll just say, if you're going to get a surgeon, a plastic surgeon, first do your research on the surgery they say that you have to have, or that the only, because everybody is different. So some people can get implants and some people can't. I couldn't. So do your research, because I wasn't thinking, I wasn't even thinking to do research. I was just trusting. And so do your research, and make sure you do your research on the doctor. Make sure you see if he has any complaints on him. And that's not really, it's good to do that, but every doctor some people are afraid of doctors, so they're scared to complain. So, but trust your instincts. I'll say that. And if you have a really good doctor, gynecologist, or, or surgeon, maybe they can, advise you or lead you in the right direction. It's kind of hard. Or if you know somebody who's used this doctor, it's kind of hard, because still it's based on you and your body, Anyway, thank you for tuning in today. And remember, love somebody. Love really is the cure to all of this insanity. I love you.